All right. Hi, everybody, and welcome to Civic Health Month and Vot-ER's physician panel. Our moderator today was supposed to be Dr. Alistair Martin, but he might be running a few minutes late. So in the meantime, I will fill in for him, and hopefully he will join us soon. My name is Alex Grayson. I'm part of the Civic Health Month team at Vot-ER. I'm a rising junior at Harvard College studying molecular and cellular biology, and we are so excited to have you all here. So next, I'll have all the other panelists introduce themselves. So first, we have Ashley Murray.
Good afternoon, everybody. My name is Ashley. I'm a pediatric emergency medicine physician at the Children's Hospital of Philadelphia in Philadelphia.
Great. And then next, we have Marlene Franco.
Hi, welcome everybody. My name is Marlene Franco, and like Ashley, I am a pediatric emergency medicine physician at the Children's Hospital of Philadelphia.
Great. And then next we have Mike Aylward.
Hi, everybody. I'm Mike Aylward. I'm a med peds doc at the University of Minnesota, and I also am part of a grassroots physician organization called Minnesota Doctors for Health Equity, which I can talk about a little bit later. And we're a partner with Vot-ER.
And then finally, we have Nate Jones.
Hi, everyone. My name is Nate Jones. I am a third-year pediatric emergency medicine fellow at Children's National here in Washington, D.C. I'm also an executive committee member of the AEP's section of Minority Health, Equity, and Inclusion, and which we're also partnering with Vot-ER.
Great. So as y'all can see, we have a great panel. I would like to point out that we do have a chat, but I'd encourage you, if you have any questions throughout this webinar, to point your questions to the Q&A section. About the last 15-20 minutes or so, we'll answer any questions you put there. So feel free to send them as you think about them. No need to wait until the very end. So to start off, I'd like to invite everyone, all of our panelists, to sort of share what drove them sort of get involved with this type of work and sign up for a Healthy Democracy Kit. And anyone can start, whoever feels so moved to go first.
For me, it was very much trying to understand how do you, as a provider, as a healthcare provider, enter that space of civic engagement and sort of empower your patients and families to do the same. And with not a lot of time, not a lot of resources, it's very hard to sort of figure that out on your own. And so I think Vot-ER's tools have been super useful to sort of give people the education and show them the link between their involvement in having a healthy and successful community, and also making it easy for us to sort of have those conversations with patients and families. So it was just a great tool to sort of tap into and something that I've been looking for the last couple of cycles. So it's been great.
Yeah, I would echo that in terms of the kind of usefulness of the tool itself. I think the kind of the work, so to speak, is registering people very practically to vote, and then also empowering people, providing information for people who perhaps are disenfranchised or feel that they're disenfranchised, and telling them that they can in fact vote. A couple years ago, we did a voter registration drive in my clinic, and there's a whole bunch of people who had felonies, but the felony had lapsed. And in Minnesota, 7 years afterwards, they're able to vote. They were not aware of this, and so just providing the education, I think, is useful. And the kits allow kind of a easy, opening, seamless way of doing this that takes a lot of the kind of Monday, I mean, it sounds ridiculous, but all the kind of friction of actually getting to the website, registering, having the person register, all that is really taken care of, and you can focus on the positive aspects of why voting or registering and voting are important for individuals and for their communities.
I was going to say that I think for me, recognizing and understanding how vital, what is the one thing that affects our health of anything, right? We talk about vaccines, we talk about food, we talk about housing, and all these determinants of health that really impact our patients, not only working in the emergency department, but anywhere we see all these factors, right? We prescribe pills, we prescribe physical therapy and surgeries, but we don't prescribe civic engagement. It's really always been something that I think we felt maybe uncomfortable talking about with our families and the importance of it. But then working in ER, I talk about seatbelts and helmets. So well, where did seatbelts and helmets come from? Well, they came from policy and legislation. And so it was kind of that epiphany or awakening earlier in the year that I really took on board that we should also be talking about civic engagement with our families and the importance of how to change our communities. And I think Vot-ER, as my colleagues have mentioned, has really made this much easier for us as physicians to bring it up. You know, when it's on your lanyard, often families look at it, or you can bring it up and say why you're waiting. And I think it's really made this conversation more seamless and now more natural, and then the buy-in that it's important.
Yeah, you know, I want to echo what some of my colleagues have said. You know, I'm a newly or more recently joined member of this effort. And for me, what inspired me was really feeling very discouraged and feeling really the need and the desire to do something. So I think we can all agree that 2020 has been a challenging year. You know, the pandemic certainly has shed light on a lot of the inequalities within our society that were already there before the pandemic, and it has exacerbated it in many, many ways. And we see it, right? So I know I work with Ashley, so you know we see it. We see the results of it every day when we care for children in the emergency department. And so it was very easy for me personally to feel discouraged and feel like, oh goodness, you know, what else can we do, right? What can we do beyond taking care of kids right in front of us? And Vot-ER was something that it's really low effort, right? And doesn't require a lot of time. It's very easy, but has huge impact, can have a huge impact. And so it feels great to be able to do that and have the ability to empower people to make their voices heard, and you know, change the determinants of health that they can change via voting.
Great. Well, thank you all for sharing sort of why you got started. And I agree with all sort of the sentiments you expressed. And, you know, sort of the overview was that you guys were talking about how there really is a connection between voting and health. So Mike, would you like to explain sort of that a bit more?
Yeah, so I want to go back a little bit to a little bit of a story, and I'll get to that very quickly. This won't be too long. So back in 2017, a group of us in Minnesota got together and realized we wanted to do more outside of the clinical environment, and realized that kind of advocacy around health equity was going to be our kind of method of doing that. So we created this organization called Minnesota Doctors for Health Equity, which is grassroots, and our focus is on, we're a nonprofit, our focus is on educating health professionals to advance health equity, so training people how to be advocates. As part of that, you know, it's very clear that all the social determinants, and I actually prefer the term social drivers of health, and the reason for that is that these things are social constructs. They are not immutable, they are changeable, and, you know, but by advocacy, policy, social justice movements, that's how these things change. And so if you believe the social drivers of health are the main things that are impacting the health of our communities, which I do think is the case, then, you know, policy, civic engagement, that is the main way of getting to enact those changes. And so in 2018, we did some voter registration efforts without all the smoothness of Vot-ER. So it was pretty rough. We weren't able to get as many people registered because we didn't have great systems. But we did look into some of the data behind voting. And there's some interesting health related data. So specifically in communities that vote, young adults have better mental health outcomes, they have higher levels of education, and they have higher incomes. And similarly, in those same communities, especially those communities that have a high poverty rate, communities with a higher voter turnout have lower income inequality, and they have higher wages in those communities. And then socioeconomic inequality is exacerbated by lack of voting. So communities with lower civic engagement have poorer self-reported health. And lastly, states that have high voter turnout simply have better healthcare. And so, you know, there's a small amount of data, but it's you know, tied to civic engagement. And if we can empower our patients to vote, and not just vote, I think the key thing here is this is a presidential election year. This is important. This is a very important year that we're voting. But really, the reason why my group is Minnesota focused is because we have a lot of power as physicians at the state and local level. There are tobacco 21 ordinances that are passed. The police and education funding is often determined at the local level. We should be voting for city council members, for local representatives, for people on the school board. Like, it's this kind of community, local focused voting that is going to make as much, if not more, of a difference than voting for the big elections every 4 years. And so this needs to be a sustained effort, and not just kind of popping up every 4 years. It should be, essentially every year, maybe every 2 years, to get people to vote.
Great. Thank you for sort of, again, highlighting more of those connections as well as those like really important trends. So a lot of physicians, obviously want to get involved. Hopefully we have some people on this call who are sort of excited about starting up or at least ramping up their efforts at their own institutions. So Ashley, could you speak more about some of the challenges or even some exciting moments with working with large institutions?
Absolutely. And I've tried to break it down into 5 key take-home points, which I'm happy to put in the chat box when I'm done. But I've been working with our institution for about 8 months now. And my institution is very, very large. There's a lot of infrastructure and understanding the leadership at the hospital. And being a children's hospital has its own unique challenges because they really focus on the way the community views and sees the hospital, which I think is really important for patient satisfaction. But I would say the kind of key 5 learning points or takeaways that I've learned is the number one is patience, being patient with your institution. Oftentimes, as an emergency medicine physician, we act very quickly, we make decisions very quickly, we want to move very quickly. This is often not the case when you're looking at larger programs. So patience is important, but persistence is equally as important, and making sure that you have a team or a stamina of people that continue pushing these issues forward and why they're important for your community. Number 2 is storytelling. We started with stories, and I think it's important the value of those stories. We all have experiences with our own patients that we talk with that we remember, right? And those stories are inspiring. They show empathy and they show the human connection, which I think is really, really important when you're talking with leadership. Number 3 is data and answers. Leadership wants to know data. Vot-ER has data. Lots of government sites have data. They want to know the percentages of why this is a problem and why this is important and why it's important that we engage. And then they want to know answers. They want to know answers to their questions about information security, information technology, marketing, what other experiences your other hospitals have had. So when we started this up with our hospital, the first thing I did was actually called and spoke with other hospitals in the area who've done similar work to understand the challenges, so that when the legal department, particularly at our hospital, asked us, I had those answers for them. And that really shows that you've done your homework. Number 4, partnerships are the key to success. You can't do this alone. Recognizing what those key partnerships in your hospital are going to be different. I know for us, engaging with social work department has been really, really important. And engaging with our operations team are those key partnerships to make things happen. And then lastly, number 5 is investigating and presenting similar models. So, Vot-ER is that model that we're using, but there are other agencies and nonprofits in your area that have done similar work. So it's important to know what's already been done at your institution, so that way you can get all those key stakeholders involved. So those are my 5 key point takeaways, and I'll type them out in the Q&A if you have any questions about them.
Great, thank you, Ashley. And then also I just wanted to highlight a question that was brought up already and that you helped to address in case anyone else would like to voice any extra thoughts before we lose sight of it. But it was just sort of asking about how with COVID, a lot of the badges and thus the lanyards are hidden underneath the gowns. So how do you have success with sort of engaging with patients and parents? And so Ashley, you had mentioned, while you're waiting for the test results, have you checked your voter registration status and sort of engaging with them in that way? So do any of you have some extra thoughts to add before we sort of move on to our next question? All right, totally okay if not. So our our moderator, Alistair Martin, has joined us. So Alistair, just sort of to catch you up, we've been talking about, why people decided to get involved with this work and get healthy democracy kits, the connection between voting and health, as well as sort of the challenges and the takeaways that Ashley is dropping in the chat right now about working in a large institution. So if you'd like to take over, by all means, go ahead, add in any of your thoughts or what else we've addressed. You have
Great. Thank you all. Unfortunately, I'm at the hospital right now, so unexpectedly, as is sometimes the case with us as we do this work, taking care of patients. So, Alex, actually, I think you've been doing a great job. Why don't you continue moderating? I'm going to be listening in and switch over to panelist role. So please continue going, Alex.
All right, great. Thank you. Yes, everything is always so up in the air in this type of work, but we go with the flow. So next we can sort of cover okay, you have a kit, you're starting to work with your institution. What is that like talking with patients about voter registration? How does that work into your workflow? I know, Nate, you had some points that you would like to make about that.
Sure. Yeah. I was going to answer, this also answers the question you brought up a little bit earlier. But you really do have to be proactive in the time of COVID to get people to sort of see. I mean, people do see your lanyards, but not everybody sort of feels empowered to sort of ask about it. But I sort of incorporate it into my workflow in a way. I ask two main questions. One, are you registered to vote? Which is clear, and most people are sort of just like, yeah, I totally am. Yeah, I'm great. Or I'm not, or I have no idea. In which case I show them the QR code and they go from there. The second question I ask is always, have you requested a mail-in ballot? Which I think that's something that we kind of miss along the way, is that a lot of states, especially states that have already been doing mail-in ballot before, that's something they can easily tap into. And there are states that are going to be trying to do it, and it's going to be a very interesting experiment for the 2020 election, to say the least. But I think adding that question is important, and it's also part of how you can request it through the Vot-ER tool. I try to do the same thing that Ashley brought up, where I sort of do my, history, physical, talk about the plan. After that's already been discussed, that's when I bring up those two questions. And so while they're waiting for like an X-ray, or they're waiting to get their labs drawn, they can sort of register to vote or register for a mail-in ballot. At the same time, once the visit's over, if they're going to be either admitted or going to be going home from the ER, I usually sort of follow up and say, hey, remember we talked about that voting registration? Have you had any troubles with it? Any questions? That way you can sort of follow up and get people to sort of be like, oh yeah, you did bring that up when we finished that, or I did have a question about voting. And usually I can answer the question. Sometimes I can't, but I at least know to refer them to the Vot-ER website, which has been very helpful for people. I think some of my observations from those things is that I would say 99% of the people are very excited that physicians are asking these questions. I think that families and patients sort of take it as you're sort of valuing not just the medical world that they're occupying in, but also sort of the political and the policies that sort of are impacting them. So people generally really appreciate them. And I try to ask everyone, regardless of their background. Language is always tricky, but it's one we try to work around with our interpreters and our ED. And then I'm also just surprised. You never know what people's responses are. I've met people who like are poll workers that are so excited and getting ready to plan out the election, and people who have no idea that what was going on and what they needed to do. And so you sort of go across the whole gambit. So I think it's been great to have those conversations with people.
Great. Thank you for sort of sharing that with us. And so, you mentioned patients are really excited, but oftentimes, you'll be out doing this work and colleagues will start to notice it. And they may not necessarily be excited. They may even be skeptical. So Marlene, do you have any advice for people like addressing skeptical colleagues?
Yeah, so it's kind of piggying back a little bit on what Ashley mentioned earlier. I don't see this kind of work as being separate or different than what we already do, particularly what we do in the emergency room. Our job goes beyond addressing the injuries and the sickness and, the symptoms that are right in front of us, right? It goes, I see our job as really addressing those factors that have a direct impact on people's health. So I don't see it as any different than screening for intimate partner violence, or talking about helmets for injury prevention, or educating families on food resources for families who are food insecure. This is very similar to that, right? So just to give one small example, not all states have expanded Medicaid. Access to Medicaid and access to healthcare has a direct impact on people's access to care, and therefore health outcomes. And who our families choose as their elected officials is going to have a direct impact on that. And so empowering families to be able to make their voices heard and choose elected officials that are going to best advocate for their needs, I see that as part of our job, and it's as part of what we do every day. And I think when you kind of step back and look at it that way, you see it's not a jump. This is completely within our lane.
Great, thank you. So now we're moving in back into like sort of open questions. You know, everyone can comment on this or just one. Sort of going into, you know, these patient interactions, providing stories if need be. So do any of y'all have any challenging questions that you've ever received from a patient, and how did you address that question? So it could be, you know, logistics for their given situation for voter registration, or a question about why you're doing this work, things along those lines.
I think I work in a federally qualified healthcare center, and we see a lot of patients who are undocumented, and so you know, asking about that status is tricky, and I mean, we really shouldn't be. It can undermine a lot of things, and anyway, there's information that's disclosed that's probably not relevant to care, but asking about voting in that can be challenging, and so, you know, I just kind of ask people about the voting, and then they'll say, you know, I've had people who say, you know, I can't vote, or, you know, they'll just flat out say why they can't vote. And sometimes it's a felony, sometimes it's because they're undocumented. But sometimes it's something that is kind of alterable. And so it's not so much pushback, but it's, I think for people who are distrustful of the federal government, which I think in this time it's very reasonable to be distrustful of the federal government, people will ask why. And I think, you know, having a quick, well, you know, I'm asking all my patients because this is an important part of keeping our communities healthy, just having a quick go-to line can alleviate that, because it's not something that's usually part of it. And the way I've been addressing it is just in the social history. I ask it as part of like, where do you live? Where do you get your food? Where do you know, what's your education level? All that kind of stuff. And this is just another component of it.
Great. Anyone else have any additional thoughts with this topic?
I was going to say it's not quite a challenge or a conversation I've had with families, but one of the barriers I've encountered, I work in New Jersey as well, is that New Jersey does not have online voter registration, or so it's all paper. So there's pros and cons in the state. So for example, getting a mail-in ballot is an opt-out. So everybody gets a mail-in ballot. So that is one positive thing, that those mail-in ballots come to our homes without us requesting them. But then on the flip side is that to register to vote in New Jersey, you have to print out your form. And so that's been a challenge working in the New Jersey Emergency Department. And so we've worked with our hospital a workaround of how to help print those forms and helping families mail those in. And that's really where the relationship with social work has been key. So I just want to be aware of that with the individual state you work in as you engage your families.
Ashley, can I actually give you a follow-up question on that? So are
Sure.
Are you able to, yeah, can you just give us a little bit more details about how you're getting those forms printed? This is a selfish question because I also live in New Jersey.
No, yeah. So I think other people may have similar questions. So there's two approaches. So one, we've engaged with social work. So they have agreed that they can print, but also we've engaged. We have a family resource center on one of the floors in our hospital that is open from 7 a.m. till midnight. And we have stocked materials there. So we worked with leadership in the resource center, as well as the Ronald McDonald House, to offer materials, including envelopes and stamps for families that they can print these materials. And so the Vot-ER QR code does, which makes it really nice, is that it pulls up the auto-populated form when families fill it in, so they don't have to figure out what the form is. It does all that work for them. So it is still a 90-second process, plus then printing and mailing. And that's really where it's going to be important that you as a provider understand that, but also that your department can support those families and that challenge that does exist, because not all of our families have printers in their homes, and not all of our families have stamps and envelopes. So I think that's just something that to add to the work that we're doing.
Thank you for that, Ashley. That is one of the hardest scenarios for us to solve for. And, you know, we look to folks who are innovators like you, Ashley, and many of our other partners in states with no online voter registration to come up with awesome workarounds like that. So thank you for sharing that. The question that Alex raised is a really good one in terms of have we had any difficult experiences with patients or difficult questions that have come up? And I would say I've probably talked to, at this point, over 100 different patients about voter registration. And I would say that in a healthcare setting, and what I'd say is that the fear that I had before the first time of doing it was that the conversation would go south, or, you know, it would trigger a much more sort of difficult, contentious series of questions. And out of 100 times, that just has not happened. I'd say the one really interesting challenge that I've come up against was just in my last overnight shift, maybe about 2 or 3 weeks ago. I had a patient who just returned from St. Thomas. He was there living for like 5 to 6 months and was just returning back to Boston. And we were having a conversation and asked him, you know, with COVID and with everything that's going on, you know, I want to make sure that, you know, all the normal things that you're doing, like checking your voter registration, things like that, are happening. Do you have your, have you checked your voter registration status? You're moving back from St. Thomas. He said, actually, I don't know if I can vote because I was just living in St. Thomas. And he asked me, he's like, do you know? And I had no idea. I had absolutely no idea. And the good news is I didn't have to know. We actually have on that Vot-ER landing page where we all send our patients, there's a 24/7 hotline that our patients can access to ask those kinds of questions. So the next thing I said to that patient was, I actually don't know if you can register if you've been living in an island that's not the United States for the last 6 months. But the best thing for you to do is actually just call this number, and you can get on the phone with them right now, and they can tell you the answer to that. So that's good to always have a backstop, because we don't need to be experts at this work, but we do need to get the conversation started and then hand folks off to the experts who know.
Great, thank you. And yes, I agree. You know, sometimes it's okay to admit that you don't know things, even though you guys are all experts, it seems like, to your patients, you know, admitting, hey, I don't know this, but here is another expert that can help answer your question, can be super helpful. So for our attendees, if you didn't know about that hotline, now you know, and definitely feel free to use it or recommend it to others. The next question I have is sort of, again, an open question. What has been the most surprising part of having these conversations with patients? So it could be good surprising, bad surprising, just anything that comes to mind for surprising.
Honestly, it's I mean, it's surprising that so many of my patients are actually already registered. To be honest, I think that's, and you know, people who've gone to quite extensive lengths to be able to vote. You know, going from, you know, refugee status to becoming a citizen, and then you know, voting in every election since they, you know, the day they became a citizen. That is amazing. And at the same time, so that's the positive piece. At the same time, I'm just stunned. It's the effects of the criminal justice system on voting. And I mean, to say it's a mechanism for voter suppression, I don't think is like unjust, but it's stunning how many people are not able to vote because of felonies. And you know, when we hear about it in the news, you always think about, you know, people in prison. I mean, these are like some of these offenses are, anyway, they are kind of often low-level drug offenses where like addiction treatment would have been better than having somebody having a felony and then losing the right to vote for a long period of time. And that is pretty stunning how often that happens.
I think it's interesting when we have those types of conversations because it kind of sparks ideas for other forms of advocacy. So just even hearing Mike talk about his sort of experience there just like makes me think about how many other patients we have here in DC or Maryland or Virginia who have similar issues. I will say what's been the most surprising for me is largely that everyone's registered to vote, which I thought was just a DC thing because everyone's so politically active here in DC. But also everyone's really excited to vote, which is what I think is the scary part of, you know, voter registrations. You want to get people registered, but you also hope that they also show up to the polls as well. And I feel like there's just a level of excitement and a level of civic duty that I think people are displaying that I think I did not anticipate. So I'm definitely seeing that with more and more of my patients and their families.
Great. Anyone else have any other thoughts on this? All right. So the next question I have for you all is, do you have any inspiring stories after having these conversations with patients? So, you know, it could be a patient you were working with who didn't know they could be registered to vote, and you got them registered and now really excited and they're sharing it with family and friends, or you have a patient who came in to try to get help and you couldn't necessarily address what their issues were within the healthcare setting because they needed to really get out to vote and get those situations changed outside of the hospital. Just any patient stories that you might have in regards to voting and this work.
I mean, I think so. Aside from the vote, so I had a patient who was unaware they were able that they were able to vote, like I mentioned before, and you know, talk them through the process, and then we had a discussion about some of the kind of, they actually were asking me about, you know, what I thought about Medicaid, for example. And you know, the balance here, and the thing that we're not talking about or we haven't really brought up explicitly, is there's a fear by the powers that be that this will become a partisan discussion, and that we would be, you know, in some way abusing our power as physicians and caregivers of patients by directing them towards a certain person to vote. And that's clearly not at all what this is about. This is about giving people their, you know, making sure that people can take advantage of a right of citizenship in the United States. But we're also experts to a certain degree, and the patient asked me about, you know, Medicaid, because they had heard, and there was a specific Minnesota version of Medicaid that we don't have to get into the details, but they had heard that it was, you know, expensive and bad for you, and that the people they knew on it were struggling. And so it was an opportunity to just kind of talk about essentially what's a safety net system. And we know that kind of Medicaid and access provides all sorts of different benefits beyond the immediate health insurance piece. And so it was an opportunity just to have a discussion about like a nonpartisan policy piece. And I didn't tell them they needed to vote for Medicaid, but I did dispel, or the Minnesota Care proposal that was being put forth. But I did dispel some, you know, rumors and misunderstandings that they had around it. And that was pretty cool. all in a 15-minute primary care visit.
I had one last night. Can you guys hear me, by the way? I'm sorry, I'm outside the ambulance bay, yeah. So I had one last night that was pretty inspiring. I was just wrapping up my shift in the ER in one of sort of our lower acuity sections. And we had a patient who came in who was on chemotherapy and was in his 70s and is not the kind of person that we want to have voting in person in November. And so I remember asking him, do you have a plan to vote in November? And he said, yeah, of course. And I said, okay, great. Do you plan to vote from home or are you going to be in-person voting? And he said, well, I haven't really thought about that yet. And I said, well, honestly, looking at your past medical history and what you're going through now, I think that it would be a good idea for you to vote from home. I think that's probably the safest option. Do you have your mail-in ballot? And he was like, no, I don't have my mail-in ballot. And, over the course of literally 90 seconds, he, I remember the first thing he said was like, wait, you can do that? And that was really cool for me to see in someone else. I mean, because we do this, we kind of do this now. This is it's not to say that it's gotten old, but it's always fresh to see someone else for the first time realize that we can help them in this new way. He just was so grateful for that. And, within 90 seconds, he got the process started to get his mail-in ballot. And, he will be voting from home this year. So it's these little wins, these little victories. Often medicine, as the docs on the call know, a lot of the things that we do for our patients, we don't have control over the overall outcome. And we have to just sort of be okay with that. But this feels like an immediate and sort of instant gratification kind of thing, which feels really good to be able to do.
Great. Thank you for sharing that story, Alistair. Does anyone else have any other stories that they'd like to share? No? All right. So we do have one question in the Q&A section. So if you'd like to have a question answered, please go ahead and submit it. We're going to dive into those questions. So the first one that we have is, this might have been covered already, but how do you suggest getting your department on board? Ashley, I think maybe you're the best person to sort of speak to this, since you've talked about like institutions.
Yeah, so that's a great question. And there are a couple of 5 key takeaways in the chat for you to take a look at. But I think from within your own department, I think are similar to the institution. I think for me, I was lucky to have a division chief who supports this work. But I think it is really, really important before you take this larger that you get buy-in from leaders within your institution. So knowing who those leaders are, coming to them with data and answers and stories is really, really important. And oftentimes they don't have a lot of time. So coming to them with I'm not gonna say an elevator pitch, but a well summarized plan. And then also the commitment that you're gonna be in charge. I think for my department, my division chief likes a solution to a problem instead of just saying, we should do this. It's saying, we should do this, and I'm gonna do X, Y, and Z with the following people. So I think when you go to your head of your department, coming with them exactly what the action steps are that you're going to take. And then the other thing is come with a little bit of humbleness that you may not know what you're doing, that you're going to rely on other experts. And I think that is really important, especially in my role as more mid-level faculty, learning from my predecessors who have done a lot of this work in the past, especially with the paper voter registration. We've had a lot of those events in the past. And so coming with them, recognizing that this has been done, it may have been successful in the past, but we have this really efficient approach now that we're gonna take, and that's what I'm gonna be in charge of. And I think that's really helped my division support as well as spread this more institutionally. And I could talk for hours about this, but I think that's a good summary.
Thanks, Ashley. Does anyone else have anything to add to this? Personal experiences also trying to get their department on board?
I think the voting and health equity topics engender a certain kind of response, and that is overt enthusiasm and little action. And so I think, you know, people really say that this is important. And I can't tell you, since we started doing health equity work, how many people talk about like, boy, this is really why I became an administrator, or I have a master's in something or something in health equity, and they tell me about it. And then I'm like, well, what have you actually done? I mean, great, you got a degree, do something. And so like, that's the initial foray. You usually get a really positive response. And then it's about kind of pushing to make sure that people follow up on it and that it's not just lip service. And that's what advocacy is. You know, I mean, I think people are busy. There's conflicting values. There's time. There's worries from legal and all sorts of stuff. But I think it's really ultimately just a series of conversations you have with individuals to try to get people from the point of saying, yes, I agree with you, to, okay, let's do something together. And so that was really what Ashley's list was getting at. But I think that's kind of the uniform approach. And now there's a lot of talk about social justice, and a lot of, you know, all of our organizations have made, you know, emails and statements about Black Lives Matter and all sorts of things. This is a concrete opportunity to say, here's something you can actually do to kind of align with what you're actually saying you want to do. In addition to, you know, having a diversity, equity, inclusion task force, which is great, here's something else that you can do that is concrete. And I think that's the kind of conversations we should be having. They can be a little pointed, honestly. And I'm not, and I think that's okay. I think it's okay to have a conversation that says, like, these are the things we say and these are the things we do, and they're not always aligned, and let's work together to align them more closely.
And I just want to emphasize what Mike said. I think we started this journey in February at our hospital, and it was really, really challenging. And I'm not going to say that, I'm going to say that the protest helped us push this movement forward, because we took a pause during the peak of COVID. And when I came back to administration afterwards, and they were like, oh, well, there's still COVID. I was like, yes, there's still COVID and there's still racism. And now it is time. And I leverage that to say, well, now it's time to put action where our words are. And for us, it was easier to get leadership on board, because they are doing just like what Mike said, creating goals and objectives. And I said, this is now an actionable objective that we should be working towards. And it became a little bit easier in that conversation.
Yeah, I'm so impressed by what Mike and Ashley just said. And in particular, Mike, I didn't know we were taking the gloves off on this one, man. That was real, man. Yeah, no, I think, you know, we have to call it what it is. A lot of this stuff is just optical allyship. And it's hospitals looking like they're solving the problem, but not actually solving any problem. Or the problem they're actually trying to solve is, we need to look like we are trying to solve a problem. And so thank you for your Black Lives Matter email. Now show me what you're doing has sort of been my general response. And that's what I've been, you know, institutionally here trying to push for, now that we have this window where folks who are not the usual suspects, who seem to sort of care more about racial injustice and systemic racism. And so, yeah, I think that there's a crucial window here, as Ashley just exemplified. One other thing I want to do is just really highlight what Ashley said, which is, when you try to change people's behavior, often the idea is to make them have an epiphany, right? Tell them all these interesting facts and motivate them to the point where they reach some critical threshold and they overcome whatever barrier they had, and they do the idea. That's not how it works. So at least for me, that's not how it has worked. The way I have approached things is make it extremely easy, lower the barrier all the way to the ground, and make it like, why aren't you doing this? And so we can help you with that at Vot-ER. That the FAQ page that we have has all of the documents that you would need. including one-pagers, because administrators love to see one-pagers. We get asked all the time, do you have a one-pager we can show to our administration? I have no idea if any administrator is actually reading any of these one-pagers, but it seems to be a signaling mechanism that we need. So there you go. It's there. It's in the FAQ page. There also often is some question around the legality of this. Okay, great. We've got Perkins Coie, who's done a whole legal brief on this for the American Hospital Association. You got that in your back pocket. If you need some data in terms of why this is important, that's also in the FAQ. And so having those documents ready can be very helpful for you on the institutional leadership front.
Great, thank you, Alistair. And the FAQ he mentioned is in the chat. Any other thoughts?
So I wanted to, we're running short on time. I wanted to put a little plug in for a event that is upcoming that Alistair is actually going to be a panelist on August 30th at noon Central Time. We're having, so Minnesota Doctors for Health Equity is having this screening of a movie called Capturing the Flag, which is a documentary around the voter suppression, the work that was happening in North Carolina. And we're going to have a group of panelists that include the producer, a civil rights lawyer, Alistair, and a representative, a state representative from Minnesota. And it's, you know, the people there are at least from local government, the topic is clearly nationwide. So I think Vot-ER is going to send out links to this, I believe, at some point to be able to register. But if you're interested, we've had really good success with this kind of dyad of a movie or a book and then a panel discussion where people can kind of think about things and actually have a really great interactive discussion. So August 30th at noon Central.
Great, thank you. So yes, as noted, we are almost done. So if all the panelists want to go around and share like quick, like 1 minute final thoughts in the discussion we had today, that'd be great. Marlene, we could start with you.
Let me unmute myself. So for the pediatric providers out there, if I could just give you one last reminder, let's not just focus on the families, right? So we also see patients who are gonna be of voting age by the time of the election. So remember, they all bring their phones with them. They're all on their phones scrolling while they're waiting for us or waiting for test results. So let's remember the adolescents and those young adults that come.
Great, thank you. Next, I'll do Nate.
Yeah, I just want to put a plug in for the AEP's Vote Kit campaign. We partnered with Vot-ER, and I think we're focused a lot more on health equity this year. And I think it's a powerful tool, a powerful campaign to convince, and especially if you're working with your department heads, that the AEP's already been behind this. So I think just putting that as a plug and something that is a useful tool to get out and get organized.
Great, thanks. Next, we'll do Ashley.
I was going to say, when working with your institution or leadership, use your support folks at Vot-ER. I've had numerous conversations with many of them. And when they learn that this is bigger than just you, because oftentimes if you just go to them, your individual self, but if you bring the organization with you and the nonprofit with you, they may be more likely to listen. And that's been really, really helpful for us.
Great. Next, Mike.
I would just say that that we all live and are part of, we all live in, have families and live in communities. We all work in systems. We're all, we are engaged to some degree in government, and we should be using all of these different levers to move the needle on this. This is one example. Another really concrete example is kind of pushing to embed this kind of these ideas into medical education itself, so that the students that are coming up for the next decades and generations will be considering civic engagement as a public health intervention, not as this thing that's on the side that other people do. And I think we're all in positions where we can enact that change.
Great, and then finally we have Alistair.
I'm gonna actually do 2 points here. I'm sorry, Alistair, going off script. The first is you have the law on your side. one of the most common questions is this legal? Can hospitals and doctors even be doing this? You have the law on your side. The 1993 National Voter Registration Act makes it not only allows it, but makes it encouraged for nonprofits and other organizations that dole out either federal services or federal funds to do voter registration in a nonpartisan way. You have the law on your side. And I will just say one last piece is that the reason why we register to vote at the DMV is because of that law. It's the only place where that law has actually been enforced, is the DMV. And I'll ask you a question that often when people ask me, is this legal? Why would we vote in a hospital? Why would we register to vote in a hospital? I often say, why are we registering to vote at the DMV? What the hell does driving have to do with voting? So keep that in your back pocket. The second thing I'll say is that we have 2 really awesome competitions going on. You should be, I'm addicted to these 2 scoreboards because I myself want to know which is the medical school out of the 50 that we have that's going to win this thing. We've got a national competition with 50 medical schools competing to see which is going to register the most voters. The link is in the chat, number 1. I'm also curious for which state has the most civically engaged physicians. And so we have a separate competition with all of the different states, seeing which states' healthcare providers get the most people registered to vote. That link is also in the chat to give you the
Wasn't
up-to-date.
Pennsylvania number 1 yesterday, maybe?
It was number 1 for the day.
Okay.
Pennsylvania was number 1 for the day, but North Carolina is the number 1 all time so far. Well, at least, sorry, since I think we started counting July 1st. And then
Ashley and I are just getting started, so.
That's right. And then guess which medical school is winning. I want you to take a second. It's actually the University of North Carolina Medical School. So shout out to North Carolina. And if you feel like your medical school should be winning, or the one that you're affiliated with, start reaching out and coordinating with some of the team captains. Lastly, I'll say my money is on University of Minnesota. I think Mike, your state has the highest level of engagement in voting across the country anyway, just in voter registration period. So I've got my money on U of M.
All right, thank you. So yes, Alistair mentioned those links are in the chat, and it is 1. So thank you all for attending. I'll be sending an email out either later today or tomorrow, so you can get a link to this recording so you can share it with your networks, as well as the contact information for all the panelists in case you have further questions. So yes, again, thank you so much for attending, and go get people registered to vote.